is a student seed grant opportunity by which students can propose a project and receive funding for it. And it came from, used to be used for faculty only, but they opened it up for students to be able to gain funds, which is awesome because it's not often that you get to be actual implementers of a grant. There are not a lot of student experiences where you are the principal investigator or co-investigator. Oftentimes we're the research assistants. So this is a really hands-on applied experience that you really can't get anywhere else.
I would say the one word I would use to sum up the Health Innovation Seed Program is collaboration. Our grant is really bringing together student investigators from multiple institutions and thinking about things from multiple different disciplines all under one roof.
So our project is aimed at increasing self-efficacy and social support among refugee women who receive services at a nonprofit in Clarkston, Georgia. And we're doing this project by creating a digital curriculum to supplement the health education provided at this nonprofit. And we're making videos with women who are receiving services at the nonprofit, and it's a community-based project.
Our project is focused really on the issue of improving family health history gathering. And so family health history is really important for predicting many different chronic conditions, cancer, diabetes, heart disease. And so there are quite a few tools that are existing, but oftentimes they're quite clunky and there are challenges with the public using them. So our approach was to look at two different commonly used tools and work with community health workers throughout the state of Georgia to learn about whether these types of tools would be useful for them. And community health workers are a workforce that is really well positioned to help patients in using these tools since they have wonderful relationships with families and can facilitate conversations. So we conducted 30 qualitative interviews with community health workers throughout the state of Georgia and also had them do a usability test with the tools.
So my project is about qualitatively study the barriers and then the risk behavior determinants in Atlanta area among healthcare providers. So this topic is pretty important because we wanted to contribute to the local health, community health. So in my qualitative study, we use Grandis theory to investigate some of the health providers to see whether they have barriers or facilitators when prescribing some kind of preventive drugs in helping vulnerable populations. And some of the determinants, they may influence people's risk behavior or protective behavior, we don't know. So that's a good, interesting topic area to look at.
I think one of the biggest skills gained has been leading and working together with a team. I'm blessed to have awesome team members, both with our community nonprofit partner and with our interdisciplinary team. They all have helped me understand what it takes to manage a grant and bring in everybody's strengths because everyone has a certain skill that they bring for this project. So combining our skills together to be the most effective has been a good learning opportunity.
I would say the main skills that my co-investigators and I have gained are really around project management and research management. The two other student investigators are Brittany Bethia and Lawrence McKinney, who are both at different institutions at Morehouse and Georgia State University. And so it's been really great to work with them to think about the best approach to managing this grant in a really safe environment with the support from our mentors as well. So we've thought through all different aspects ranging from IRB submissions to when and how to meet and the best ways to store information. So kind of ranging from conceptualization all the way through the very practical skills of managing grants. And I think that's really important for each of us as we move forward in our careers, is to have the practice and skills to do that.
With HIP, it helps me so much with organization, always informing my ideas, it will sharpen my critical thinking. In terms of the outcome, I learn specific skills, for example, qualitative studies.
We've worked together on various projects related to family health history and community health workers. So they were really a natural fit for this SEED grant.
I have 2 grants that was accepted. For one grant, I actually list on a paper what expertise I was seeking. So I look on the website and browse every faculty who has the matching skill set, and then alternatively, the second one, I went to a workshop. The workshops is the topic of that workshop is actually the skill set I was looking for. So just went there, look at those participants who maybe look nice, look approachable, and I just went to talk with them 3 or 4, and one just acceptably, very nicely say, "I can help you." So that's the way I did it. My team is fantastic. I have a diverse team from multidisciplinary areas. So I have 4 members, 3 students, 2 faculty. So they have been very supportive, and each brings a different skills to this project. So I have my teammates from 3 different branches. One is from School of Medicine, one is from School of Business, others are from Rawlings School of Public Health.
Our team is comprised of members from Georgia Tech, Emory Undergrad Nursing, Rawlings School of Public Health, and Candler School of Theology. Our HIP application experience has been a little unique in that the team that I'm working with had previously applied for and been awarded the HIP grant. And so that project was carried on when I applied, and I decided to resubmit for our team and apply for the grant again. So the team had already been formed together prior to me joining, and they're a really great group of individuals, some who are students, some who are working at CDC, and so we've been able to carry on this project together.
So I actually knew one of my team members, Brittany Bethia, prior to this grant, and we worked together while I was a master's student at the Centers for Disease Control and Prevention. And so she began a doctoral program in the Health Communications Department at Georgia State University. And so I contacted her when this opportunity came up about collaborating, particularly because of her expertise and interest in health communication and usability testing for different tools. Lawrence and I met actually at the American Public Health Association conference. We were in a session that we had both attended the same session, and he was at the time a master's student at Morehouse School of Medicine and has since begun a doctoral program this year. So he's really a basic scientist and has a public health background, but brought very interesting skills and interests in genomics and cancer and family health history as well, but from a community perspective. So to date, we've actually finished all of our qualitative interviews, and we're currently in the process of coding those and working with the team. We were successful in submitting an abstract to the American Association of Cancer Research, and we'll be presenting that in New Orleans in a poster session in November. We've also submitted abstracts to the Society of Behavioral Medicine about our work, and we're planning to put together various manuscripts, which hopefully will be released over the next year or so. I think one important piece of our grant that's been very valuable is that it served as foundational work for an additional grant that I will be submitting to fund my dissertation work in December. And so being able to use the qualitative data to really understand some of the challenges with using family health history tools and the communication around family health history was immensely valuable in informing the aims that I have developed for this proposal.
Right now we're still at the intervention level of our project, so we're really excited to see actually what our implementation efforts are going to look like. But we've applied to present at the Georgia Public Health Association conference in May, and we've applied for some additional funding with the RISE program to supplement these funds. And we're hoping that a new round of HIP applicants might be able to carry on this project for round 2, given that we think there's a lot of promise for this kind of pilot program to transition into a bigger program.
So 2 of my manuscript was successfully accepted afterwards, and then within 24 hours. So I think the grant gave me a really great skill set to how to make things so clear, so understandable, so relatable to other scientists. So that's really awesome.